Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on VHHA.com and on popular podcast hosting apps, including Apple Podcast, Amazon, Spotify, and many others. We're a member of the Virginia Audio Collective and the World Podcast Network. Podcast episodes also air Sundays at 9 a.m. on 100.5 FM, 92.7 FM, and 8:20 a.m. across Central Virginia, and 1650 a.m. in Hampton Roads. Please send questions, comments, feedback, or guest suggestions to pcfpodcast@vhha.com. Again, that's pcfpodcast@vhha.com. 2025 is an election year in Virginia, and this November, voters have the opportunity to select who will be the governor, lieutenant governor, and attorney general for the next 4 years. As a public service to help voters considering their options, VHHA has invited the major party nominees for those three offices to join us for conversations about themselves, their path to public service, their vision, and their policy priorities for healthcare and more. As part of those conversations, today we're pleased to be joined by Abigail Spanberger, who is the Democratic nominee for Virginia governor. So with that, welcome to the show. Thanks for taking some time during the busy campaign season to do this.
I'm grateful for the opportunity to speak with you and your listeners. Thanks for having me.
Absolutely. So let's just jump right in. What we like to do to start these conversations off is to get listeners up to speed on our guests. And so to do that, we should tell you that Abigail Spanberger is a former member of Congress who represented a Central Virginia-based district. She's a product of Henrico County Schools. She earned an undergraduate degree from the University of Virginia and subsequently earned an MBA. Before working in Congress, she worked for the Central Intelligence Agency as a case officer on undercover assignments focused on fighting serious threats to the nation. Her father served in the military and worked in law enforcement, and her mother worked as a nurse. Today, she and her husband are the parents of 3 daughters, and as we mentioned, she's currently running for governor. It goes without saying that each of us is more than just a collection of resume accomplishments. So, Abigail Spanberger, beyond those details, what should people know about your unique personal story?
Well, thank you so much for the kind introduction. I think central to who I am as a person and how I grew up is a focus on service. In fact, you mentioned in the introduction, my father is Army veteran and career federal agent, and used to always tell us as we were growing up, there's no higher calling than service to country. My mother was and is a nurse because she will never retire from her efforts to help people. I once actually, with the healthcare audience, I'll say my mother once heard me say in a speech that my mother was a nurse, and she called me very, very displeased and said, "Abigail, nurses never retire. Everyone's going to think I'm dead." So I now know that I always say she is a semi-retired nurse. But that service ethos is something that I was always brought up with, and a focus on how you can do right by others was kind of central to that. I knew I wanted to follow in my dad's footsteps into law enforcement, and I did, working narcotics and money laundering cases predominantly. And then a couple years later, moved over to CIA, where I worked undercover my whole time at the agency. And my role there as a case officer was to collect information that would allow policymakers or military leaderships or diplomats or even the president to make informed decisions about issues of national security, understanding the greatest threats and working to thwart them every day. And for me, back in 2014, I was loving the adventure and the mission of my job. But my husband, Adam, and I, after a lot of soul searching, decided that we wanted to move back home to Virginia, where we're both from, and have our kids grow up near grandparents and cousins and aunts and uncles. And so I decided to pivot from that service to country model of my dad to service to community. Initially got a job in the private sector and started Girl Scout troop, started volunteering with Moms Demand Action. But it was actually healthcare that led me into politics. In 2017, when there was an effort to upend the Affordable Care Act and all that it provided for Virginia patients, pre-existing conditions protections, the ability of young adults to stay on their parents' insurance, the elimination of a lifetime cap. Those were the elements of kind of the impact that a bill that ultimately, of course, failed, a bill to repeal the ACA, would have the impacts on my neighbors, frankly, is what motivated me to run for office in the first place.
And you talked about the example set by your family, particularly your father, and service to country and community. And that's a good segue to our next question. In healthcare, we often talk about the why, or the reason that people choose a profession focused on caring and healing. As someone who, as you just discussed, has worked in federal law enforcement and served in Congress, your professional life has been focused on interdiction and the development of law and policy. I'm curious to hear your why for choosing that career path and for seeking public office.
I think it's about protecting people, standing up for people, the recognition, certainly as an intelligence officer, the recognition that everything is complicated and it is only with the most detailed of information that people can make good decisions. Recognizing that as I did, and frankly, later when I was in Congress, I served on the House Intelligence Committee, so continued to have engagement with the intelligence community in an oversight capacity. I would joke with some of my colleagues who joined that committee without any sort of background in law enforcement or intelligence to say, isn't it amazing? It's always the things you never hear about in the news that are frankly the greatest successes or life-saving efforts undertaken by the intelligence community. So, I mean, my why is always to do what's right. My parents used to always say, if you see something wrong, it's your job to try and fix it. And I think that's why I long had a focus on first upholding the law and addressing challenges that I saw, and then ultimately in the intelligence world, working to keep people safe, and then in the policy space, recognizing that nothing is simple, and everything is complicated, and that is certainly true when it comes to healthcare policy, and anything you can fit on a bumper sticker, I would argue, especially related to healthcare, is just bad policy.
And we're going to get to health policy in just a moment. But before we do, I know that you are out and about, crisscrossing the Commonwealth, talking to voters in communities large and small. As you have those conversations, as you give those speeches, and you are touting your candidacy, what's your message to voters about why they should elect you as Virginia's next governor?
My message to voters is a focus on what do they want in the leader they elect as governor. Do they want someone who will stand up for Virginians, who will make plans to address some of the greatest challenges we are facing, certainly in affordability, housing, healthcare, energy? Do they want a governor who has the same dreams for my 3 kids in Virginia public schools as so many Virginians do, which is I want my kids and all of their peers across the Commonwealth to get the best education that we, as the adults around them, and certainly as a candidate for governor, and that we can make available to them, so that the next generation has so much opportunity for success and strengthening of the communities here across Virginia that we all love. And so my pitch to voters is I will work tirelessly every day to address the challenges that keep them up at night in affordability, in education, and even just amid all of the chaos coming out of Washington. I've rolled out plans to strengthen our economy, to strengthen our schools, and to lower costs. And I intend to work hard for Virginia and Virginians every single day that I'm governor.
You mentioned just a moment ago the complexity of healthcare, and that is a segue to this next question. As you are pursuing statewide office, as you well know, as a former member of Congress, federal officials 2 hours north of Richmond in Washington have dramatically altered health funding and policy through the recently passed reconciliation package. That budget legislation includes deep Medicaid cuts that are projected to lead to the loss of coverage for millions of Americans and hundreds of thousands of Virginians. It also sharply cuts essential funding for hospitals and healthcare providers. In another recent development, the State Corporation Commission announced that several health insurance companies are proposing 20% rate hikes for ACA marketplace plans, partly in response to the anticipated expiration of the enhanced premium tax credits at the end of this year. Those are just 2 of the many complex health policy issues confronting elected officials and policymakers in states across the nation. And they have the potential to put elected officials in the difficult position of finding resources to close budget gaps that may result from those policy changes. as someone vying to be governor, that situation could confront you in a few months. And so as you look out at that landscape, how do you assess things and formulate approaches to addressing those pressing health access and funding concerns?
Well, I think principally, I recognize the dire impact that this one big beautiful bill, as it's called, will have on Virginia, and certainly, I invite listeners to see the contrast between my position on this and my opponent's, because she's certainly championed this bill and applauded this effort, which will have dire financial consequences for Virginians and for our healthcare, as well as energy costs and housing costs. But you cannot contend with a problem that you refuse to admit is real. And the reality of this bill is it will cut $26 billion of money that is flowing, that should be flowing into Virginia to provide care in hospitals. It will impact our safety net hospitals in particular. It will devastate our rural hospitals, and it will lead to hundreds of thousands of Virginians losing their care, and those who have care on the marketplace or through private insurers, those costs will go somewhere else. And so anyone who's listening who, gets their healthcare coverage through a private plan should anticipate that they will see increases there as well, because the impact has to go somewhere. And so then I look at what are the things that the governor of Virginia can do to mitigate the harms of this bill. In its construction, this bill is meant to, quote unquote, save money from the federal government by kicking people off of Medicaid. The way that they do that is through requirements on employment. Now, we have employment requirements. We have constraints on the Medicaid program already, but it is up to the state to fulfill those requirements of employment verification. Now, notably, Virginia already does this once a year, and we have a backlog in Virginia. Now, with this bill, the requirement will be twice a year, right? A requirement that somebody, frankly, in certain cases, maybe doesn't have a computer at home, doesn't necessarily have transportation to get to an office where they can verify their employment, or might be working 2 or 3 jobs just to put enough money together to be able to keep food on the table and pay their rent. And so the hurdles that are meant to basically thrust people off of care as a cost-saving device for the federal government are both highly impactful to Virginia, but also provide some level of ownership here in the Commonwealth. Now, right now, we have a requirement once a year to do those employment checks. We have a backlog because the system is here in the Commonwealth already not working. The sort of only bright light in all of this is that because Speaker Johnson, Republican-held Congress, and Donald Trump wanted to be quite cynical in the way they implemented these deep cuts, made them go into effect after the 2026 midterms, so as to not impact people who voted for this bill in their reelection. But what that does mean is it gives us a little bit of a runway to be able to try and mitigate some of these harms by constructing, and this is where it falls on the governor of any state, but here in Virginia, to create a functioning system that is as effective and as efficient in meeting those federal requirements as possible, to basically create scaffolding so that as few people as possible are able to fall through the cracks. Because that was the intention with how this bill was constructed, is that that would be the result. People would fall through the cracks, lose their care, and no longer be receiving and utilizing Medicaid.
As this year, Election Day is November 4th, and early voting begins September 19th. As voters evaluate candidates on the ballot, what website or social media platforms would you encourage people to visit to find out more about you and your candidacy?
So my website is abigailspanberger.com. We've got links to all of our social media there, where you can follow the work that we're doing and the campaign visits I'm doing across the Commonwealth. On that website, again, abigailspanberger.com, we have links to the plans that I have put out to grow the economy, strengthen public schools, and lower costs. Alternatively, you can also go to affordablevirginia.com, which is our affordability website, and that'll link you back to the bigger website to follow the campaign, but also dig into some of the policies that I have put forth and announced.
Okay. And then to close things out, we do have a tradition on this podcast where we always ask our guests a pair of surprise questions to keep things interesting. We have a mystery list of questions. If you select two numbers between 1 and 10, I will quickly give you those two questions.
3 and 7.
Okay, 3. What's the most adventurous thing you've ever done?
Done rappelling, Australian rappelling, which is when you go face first.
Okay. That sounds quite adventurous and scary. And then number 7, what's one quality in others that you admire and try to embody in yourself?
Being a good listener and being inquisitive.
Excellent. Well, I want to thank you, Abigail Spanberger, for taking some time today and for sharing your insights and being candid with us. And with that, that's going to bring us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcast and subscribe so you know when new episodes are available. And we want to once again thank our guest, Abigail Spanberger, the Democratic nominee for Virginia governor, for joining us today. So thank you.
Thank you so much for having me.